Good evening, everybody. So, I hope my screen is visible. So, now in today's class, we will have a revision of the units that we've already studied in our offline classes. Okay. So, this is your first unit. And post that, we will try to revise our second unit as well. And we will try that we can recall all that we've studied and get ourselves prepared for the exams as well. Okay. So, as you know, this is strategic management, strategic innovation in healthcare and education. This was the first unit that we had studied in our classes, and we'll have a quick recap. Then we will do our second unit as well. Okay. So, the first thing here, what is strategy? What is strategic management? And we learned that this refers to a long-term direction and position of an organization through effective allocation of resources as well as that leads to sustainable advantage. The most important thing here is allocation of resources. Okay, this here you will see few core questions where when you have to allocate your resources and map out a strategy for yourself, there are around three core questions that comes to your mind, and you have to keep it in your mind when you are trying to build a strategy for yourself. First one is where to compete, and how to sustain that advantage. Where to compete is basically your market. In that market, how you are competing with your competitors and other competition that is present, and how you have that sustained advantage. Okay, so we try to understand strategy through an example that it depends on different person at different point of time, different organization, and the resource that we have. And the example that we discussed in class was that of one night before studying kind of a thing. So suppose you have your exam on Monday. You are somebody who has prepared all semester, has been studying, going to the classes. What will your strategy be? Maybe study for an hour, study for 2 3 hours, do a quick revision, then take a proper sleep 8 hours, have a good meal, go give the exam. Somebody who was not in touch as much, so उसके लिए क्या strategy होगी? Like, okay, last night में you will gather the notes, read through the notes, maybe spend 12 to 13 hours studying, mugging up, and then sleep for 5 6 hours, give the exam. Somebody just तो बिल्कुल पढ़ा ही नहीं, पता ही नहीं क्या पेपर है, नहीं है, उसके लिए क्या होगा कि अरे बताओ क्या पढ़ना था, प्रीवियस ईयर पेपर क्या है, सारी रात बैठ के पढ़ना पड़ेगा. So three for the same exam to achieve the same sustainable goal, as you can say the goal here, what we're having, three people are having three different strategies. The strategy for first person is different from the second person and that of the third person. Okay. Here what is your limited resources? That is your time limited है आपके पास में, तो आपको अपना time allocate करना है सही जगह पे so as to make a good strategy. The first student allocates most time to sleep, have a well rested sleep, good food, and focus on just giving the answers because उसको बाकी चीजें याद है. While the second student is allocating time 50-50, कि ऐसा भी नहीं, दिमाग को भी थोड़ा शांत रखना करना और थोड़ा सा पढ़ना भी है, रिविजन भी करना. While the last one, उसके लिए सिर्फ है कि I will read, I'll study as much as possible. So different people at different point of time will have different strategy. What is the formal definition of strategic management? It is a long-term direction and positioning of an organization through effective utilization of resources and achieving sustainable advantage. Core questions will be where you compete, how to compete, and how to have sustained advantage. And now when you're making strategy, you have to make it in alignment to the vision of the company, of the organization. Also, the resource alignment कि where right now, depending on the strategy, कहाँ पे आप अपने resources को allocate कर रहे हैं. Do you need to make another branch अभी right now? That is more strategic because you have to double up the revenue, maybe double up on sales, or the revenue is right now the strategy is cutting short. Depending upon the current scenario of the market, vision of the organization, different strategies are made. And these, your how good you are in strategic management and how you are in implementing those strategies actually define your place in the market of today. For example, if we talk about Apple ka we have studied, Apple has a this of marketing have a strategy of very clear strategy of differentiation, as we have discussed, that quality product and quality differentiation, and also in many ways market leader. So now when we go ahead and we look at other examples, scale, we've discussed in very detail in class and we have had a good discussion. जब हम Amazon की बात करते हैं, then we see कि how have it has covered its logistic, how well it is with its logistics, and that scale and logistic requirements, and that has given it a very good strategic advantage on scale management and in its logistics. And that's why Amazon can operate globally and have an amazing system. Everything is in place. So that also gives it what a strategic advantage. And this is their strategy. Another example that we discussed was that of cost interruption. Cost interruption. The thing with cost interruption is that market is going in certain direction, एक certain price है सबका, and you disrupt the market. One very common example of this is Jio, Reliance Jio. When Jio started, the SIMs were given out at almost free. Data was almost free. So what happened after that? A lot of people switched to Jio, and today's time you'll see the prices are almost same. So that was cost distribution strategy. A lot of brand leaders at that point of time are not actually in the market right now. And Jio has, however, made a mark. Some, obviously, Airtel and some other companies sustained, but a lot could not in the face of cost disruption that happened from the Jio. Okay, so here what happens in this paper, we extend this beyond companies and brand and beyond firms, and we go to sectors like health and education, which is very crucial for our country. I hope this section is clear to all of you. Here we can talk about Chak De India. So they have this one goal in mind, that ek match unko jeetna, and when the coach comes in, Kabir, what is his game plan? He's like ki India's women's hockey team, they have to win at the global stage. They have to win the hockey world cup. उसमें clearly it is shown कि women's team के पास बहुत limited resources हैं. टीम सही से अलाइंड नहीं है, लोगों के इंडिविजुअल ईगो है, एंड देन दे हैव टू अचीव अ गोल. तो उसके लिए व्हाट ही डिड वाज कि ही मेड अ क्लियर विजन. एंड उसमें सबसे ज्यादा इंपॉर्टेंट, व्हाट वाज द मोस्ट इंपॉर्टेंट थिंग दैट दे हैड इन माइंड, दैट वाज अगेन one of the most important thing was that coming together of the team as a whole. In that, what happens, if you remember, different strategies were made. He asked for introduction and it's like, what your name? Preeti Sabarwal. Then they were saying the name of the state. They said ki I can just hear one name of the country, Preeti Sabarwal, India. So all these kind of examples, all these kind of strategies were used to achieve one common goal, and they did it in what limited time, in with limited resources. ठीक है. Now you'll ask कि मैम जो strategic innovation है, we are already studying as a part of our MBA course. We are doing this particular subject, which is an optional, because we are applying the principle of strategic management and we are applying strategic innovation to specific healthcare and education sector. Why so? Why UGC or your department thinks that applying strategic innovation is needed in healthcare and education, that you should be focusing your attention towards these two sectors, because these are extremely crucial. And why so? We have something known as human capital. In India, what we have in maximum population, लोग हमारे पास में सबसे ज्यादा है. तो जब हमारे पास में लोग ज्यादा है, if we want to take advantage of that, we have discussed something called demographic dividend. What was demographic dividend? Demographic dividend was a particular phase in the time period of a country where your young population is maximum. ज्यादा young लोग हैं. So India में if you see, we have maximum people under the age of 30. If we talk about a country like Japan, वहां पे क्या है? Aging population is more than the young population. So this is an example of demographic dividend. And for us to exploit our demographic dividend, to make the best use of our demographic dividend, what is needed is that we develop our human capital. And human capital क्या है? It is health into education into skills. ये सबसे ज्यादा important चीज है कि health, your human beings around you, your citizens are all healthy, they're all educated, and they have skills. Okay. So now we'll looking at the formal definition, we will see that human capital refers to the stock of knowledge, skill, competencies, and health embodied in individual that enhances their productivity as well as their economic output. Human capital refers to the stock of knowledge, skill, competencies, and health embodied in individuals that enhances their productivity as well as their economic output. याद रहेगा, health क्या करता है? Health increases duration of your productive lifetime. Health also increases your physical fitness, your individual life. Uska economic implication क्या है? That your time of productive life, your duration in productive life will be increased. जितना time आप काम कर पाओगे, आप self sufficient होगे. The productive period of your life is increased when you are in a good health. Then we have education. Education increases productivity per time unit. If health is something that is increasing your duration of productive life, पर आप एक घंटे में पर यूनिट में आप कितना काम कर पा रहे हो और जो आप की प्रोडक्टिविटी है, आप किस लेवल का प्रॉब्लम सॉल्व कर पा रहे हो, हाउ इम्पैक्ट यू आर क्रिएटिंग फॉर द सोसाइटी. ऑब्वियसली फिजिकल लेबर इज ऑल्सो इम्पोर्टेंट, ऑल काइंड ऑफ लेबर इज इम्पोर्टेंट, बट through education, what happens that it increases your productivity. If we have more skilled and educated population, जो काम वो कर रहे हैं, the productivity that they are spending per unit time, that increases. And that is what is important. If you see from a personal perspective, अगर आप देखोगे कि somebody works around 10 hours a day, and the average something the pay that they can get like is suppose 250 rupees on an average, or how much you pay a coolie, it's like 500 rupees, something like that. But per day, how much are you being paid? If you're working somewhere in an organization and suppose your package is that of 50,000 per day, you are making around 4K. So this is like कि एक दिन के अंदर में for an 8-hour shift, तो एक घंटे में जितना काम कर रहे थे आप, आपकी एजुकेशन से क्या होता है, उसकी आपकी प्रोडक्टिविटी बढ़ जाती है. एंड फॉर योरसेल्फ आल्सो यू कैन मेक मनी, एंड व्हेन यू आर एजुकेटेड you solve more problems. It is also better for the Indian society. Same with skill. What a skill does is that skill increases your adaptability and innovation capacity. When you're skilled at something, when you are apt at something, when you can do something really well, what is happening here is your adaptability increases, your innovation capacity increases. अगर population educated भी है, healthy भी है, पर skilled नहीं है, specifically क्या करने आता है, there is this famous example कि somebody comes for a job और वो पूछता है कि आप क्या कर सकते हो, then he says कि मैं MA हूँ, से कि ठीक है पर काम क्या कर सकते हो, मैं MA हूँ, और करोगे क्या काम, मैंने एमए किया हुआ है. सो वी हैव डिस्कस्ड इट इन क्लास एज वेल कि वो तो ठीक है, व्हाट यू हैव एजुकेटेड yourself, the knowledge that you have, this that is very good, that is amazing for you as an individual, as a human being, and for us as a society. You might be an aware citizen of the society, but when it comes to your livelihood, when it comes to supporting the economic role, taking up supporting your country, taking up an economic role, it is skill that becomes highly important. And highly skilled population is one of the biggest assets for any country. You will see India has even plans of sending skilled people, skilled workforce, providing skilled workforce to the world. So if we talk about a lot of programs, lot of initiatives that has also been taken in this example, in for this skill enhancement. बहुत सारी trainings होती है, आप ITI आपने देखा होगा, आपने स्किल इंडिया का नाम सुना होगा. All these things are what, all these things are actually trying to make us more skilled as a population. हमारे हमारे अंदर क्या होगी, हम हुनरमंद हो, like we are more skilled at and apt at doing the work. Also, there is in the new education policy, also, you will see there are certain changes, a lot of changes, that practical industry based skill education is trying to be provided to the students since an early age so that they can develop those skills. अब if you talk about surgery, somebody जो सर्जर कर सकता है, surgeon surgery कर सकता है. If you talk about surgeons, if you talk about space scientists, if you talk about manufacturers, if you talk about innovators, if you talk about somebody who is like a software developer, all these are what? All these are high skilled professions. That person is so skilled कि वो ये चीजें कर सकता है. So high skilled population is like way to growth right now in our country. That is the way. If we have a highly skilled, healthy, educated population, we can really make use of our demographic dividend. And that will be the optimum utilization of our human capital. What is human capital? It is health into education into skill. Okay. Now, intergenerational compounding is also high with education and with generational education. You see, educated, aware, healthy families will produce the same kind of, they will know the importance of education, will also try to send their children to school. This will reinforce economic growth, and this will happen across generation. Now we come to the second concept, that is that of public good. Public good is a good that is non-rivaler. One person's consumption does not reduce the availability of other person's consumption. Public good जो होते हैं वो दो तरह के होंगे, दो उनकी मेन क्वालिटी होगी. एक नॉन राइवलर होगी कि एक को लेने के लिए दूसरे को ऐसा compete नहीं करना पड़ेगा, और सेकंड चीज इट विल बी नॉन एक्सक्लूडिव, किसी को भी उससे हटाया नहीं जा सकता है. इट विल बी एवरी सिटीजन कैन यूज इट. इसके एग्जाम्पल में स्ट्रीट लाइट हो गया, नेशनल डिफेंस हो गया, क्लीन एयर हो गया. दीज आर व्हाट पब्लिक गुड्स. एंड पब्लिक गुड्स में क्या होता है कि कोई कंपटीशन नहीं होगा कि अगर एक यूज कर लेगा तो दूसरे को कम हम देंगे. एंड सेकंड इज नॉन एक्सक्लूडेबल होगा कि इट्स नॉट लाइक समबडी हैज यूज्ड इट तो अदर को हम इट्स लाइक नॉन एक्सक्लूडेबल होगा कि हम किसी को ऐसे हटा नहीं सकते कि these certain people will not use it. It's all and equal for all. Okay. So we come across a problem of a free rider problem. So this is like individuals may avoid paying after still benefiting for that public good. So this one of the example is ticketless traveling. We are all paying taxes. Just say the entire operation of the railways is happening when you are paying the tickets price. So what is happening is that some people are like traveling without tickets. What is happening? Advantage तो ले रहे हैं लेकिन they have not paid for it. This is what is known as the free rider problem. And now we have market tends to under provide for public goods because these are mostly not as profitable. So in most cases क्या हो जाता है, ये governmental organization की ही responsibility हो जाती है to provide with these kind of public goods. And this collectively requires, or either society साथ में जाके कर सकती है, either it could be a collective endeavor or it could be a government intervention. Okay. So if we talk about healthcare and education, so these are not purely public goods. A large part of them is significantly private. होता है, like largely private होगा, and significant part of it is also from public value. It is also coming from. So जैसे अगर आप इंडिया में देखोगे कि एक लार्ज पार्ट क्या है कि प्राइवेट सेक्टर है, प्राइवेट डॉक्टर्स बैठे हुए हैं, देयर आर प्राइवेट हॉस्पिटल्स, प्राइवेट क्लिनिक्स, यू कैन गो देयर आल्सो, एंड you can also go to public hospitals as well. So people who can afford usually would prefer private service depending upon the categories that you can afford. There are like top premium private services as well. There are mid-level, there are low. So, and then we have public goods, which is open for all. वहां पे क्या हो रहा है कि there is no competition, non-rival, and not excluding. किसी को भी किसी के basis पे वहां से हटाया नहीं जा रहा है. Okay. Then we come to our fourth topic, which is externalities. Externalities occurs when a transaction between two parties affects the third party who is not directly involved in the transaction. ये हमने कई बारी क्लास में डिस्कस करा है externalities बहुत ही डिटेल में. So I hope you will remember what it is. It is when transaction that is occurring between two parties and it affects the third party which is not directly involved in that transaction. So यहाँ पे we have positive externality. इसमें क्या होता है, vaccine protect others. So education से it reduces unemployment, it reduces crime. Negative externality क्या होगी कि if there is pollution, if there is like a road is filled with garbage street is there, filth is there, then it will affect everybody nearby. So private benefit के ऊपर we always value what is known as social benefit in case of positive externality. Okay. Coming to another topic, jo again we have done in class, which is a merit good. Merit good is that society believes should be consumed regardless of an individual's ability to pay. This has to be consumed regardless of an individual's ability to pay or willingness as well. Ability or willingness to pay, ये आपको consume करना ही है. Primary education, free and compulsory education under the age of 14. What is that? That is a merit good. Immunization programs, community vaccination, these are also merit goods because इसमें क्या हो रहा है कि society believes regardless of your individual ability to pay or your willingness to pay, this you have to consume for the greater social cause. And इसमें कई बारी क्या होता है कि गवर्नमेंट इंटरवेंशन रिक्वायर्ड होती है फॉर दैट कंजम्पशन. हमने क्लास में पोलियो का एग्जांपल डिस्कस करा था with how excessive campaigning we could get rid of and we could contain number of polio cases in our country. So what was that? That was merit good. So for example, if you have something which is known as a program or a campaign in which government is spending a lot of money, these are funded, there are people from the society who are coming contributing. What is there, what is that is happening because it is good for the larger age. जब हमने कोविड वैक्सीनेशन के लिए भी देखा था कि it was spreading. So if somebody is getting vaccinated, क्या हो रहा है? It is breaking the chain. Okay, if somebody has got vaccination, तो क्या होगा कि it is spreading through people to people. Vaccination was advertised. It was also started being given free and then affordable as well. So what was happening here? It was being used to break the chain. Community immunization programs happen. Okay. And we did really good as a country with polio as well. And today, because of that heavy campaigning, awareness, door-to-door policy, what we have today is that number of cases of polio in India are negligible, like almost very contained. We did really good. Okay. So I hope that is clear. Now we will go to informational asymmetry. So informational asymmetry occurs when one party in the transaction has more or better information than other. एक को सारी चीजें पता है और एक को दूसरी चीजें नहीं पता है. इसमें क्या होता है कि इंफॉर्मेशन असिमेट्री होती है. आप और मैं एक ट्रांजेक्शन में आए. You suppose are a new student, you don't know, this is your first day. And I am a teacher who has been teaching here for 6 years. So this is what is, I will know more about the university, more about the subject. So what is this? Informational asymmetry. Two parties are coming in a transaction. और क्या हो रहा है कि एक पार्टी को ज्यादा इंफॉर्मेशन है, दूसरे को नहीं है. समझ में आया? दो पार्टीज एक ट्रांजैक्शन में आ रही है, उसमें एक को इंफॉर्मेशन ज्यादा है, हायर लेवल ऑफ इंफॉर्मेशन है कंपेयर टू अदर. ये क्या हो गया आपका? इंफॉर्मेशनल असिमेट्री हो गया. इसके एग्जांपल में क्या होगा? पेशेंट डॉक्टर का नॉलेज क्या आप दे लो, पेशेंट को कितना पता है और नॉलेज को कितना, और डॉक्टर को कितना पता है. सेम विद अ पेरेंट एंड अ टीचर स्कूल, उसमें भी असेसमेंट क्वालिटी की बात आ जाएगी कि उसमें कितना पता है. ठीक है. Now we have something which is a new topic, which is informational asymmetry, but it is very similar to externality जो हमने पढ़ा है, but it is little bit different and it is very easy to understand. Two parties are coming in a transaction, and what is happening is that one person has better information, is better aware than the other person. Clear? Okay. So now we are trying to link health strategy to health and education. So health and education are platforms for enabling other sectors of the and of all other industries as well. It is in many way based on, for example, जब COVID आया था, we saw कि things became very slow. People were obviously not going out क्योंकि lockdown था, but what was still happening was कि in general what happened, what consumption came down. Consumption came down. Economic activity, number of economic activity were reduced. So इसमें क्या हो रहा है कि health और education क्या बनता है? It becomes a enabling platform for other industries as well, for other sectors as well, because healthy people will what they have more to contribute in the economic activities. Same with education. So strategic, so what is happening is like strategy involves in innovation, insectic designs, incentives, and these are like making more skilled population. And that is why strategic innovation is required for throughout the entire growth of the country, of course. And when we focus on the primary sector like health and education, our externality increases, our the way it will repay us increases for us as a society. So I hope you have understood what is a human capital. Human capital is health into education into skills. Human capital is referred to as the stock of knowledge, skills, competency, and health embodied in an individual that enhances their productivity as well as economic output. What is a public good? Public good is a good that is non-rivaler and is non-excludable. What is externality? Externality occurs when a transaction between two parties, in a transaction between two parties, the third party, which was not directly involved in the transaction, is also affected. And what is a merit good? Merit good is a good that society believes should be consumed regardless of an individual's ability and willingness to pay. Informational asymmetry क्या होती है? Informational asymmetry occurs when one person in the transition has better information than other person in the transition. So what we try to do is like we try to go through our first unit. I hope this is clear to all of you. Now what we'll do is that we will move to our second unit. I will share the screen again. I hope my screen is visible to you all. Okay. So in your third unit is again, I have mentioned multiple time in the class as well. Third unit is a very important unit from your exam point of view as well as from your syllabus point of view. Okay. And why so? Because isme we discuss different models. I will share all the notes with you. Don't worry about it. Okay. So if first unit is clear, we will move to your third unit. We have done the second unit in our last class, but again, if you want, we will go through a revision. We have enough time right now. So we will go through a revision as well, not in today's class maybe, but in the other classes that we will have subsequently. So in your third unit, this is about low cost innovative models in healthcare. What is low cost innovation? Low cost innovation refers about designing a system. So this system will deliver you high quality services at a significant reduced cost, and it will improve the efficiency, optimization process, leverage your integration. I'm sorry. Okay, I hope I'm audible. So here what is happening is that a low cost innovation, it refers to designing a system that will deliver high quality services at a significant reduced cost improving your operational, by improving your operational, financial, overall efficiency, optimizing your processes and leveraging your scale. It will also be technology heavy in nature. Okay. So when we talk about in healthcare, it is traditionally associated with high infrastructure requirement, skilled labor, and high technology requirement. Agar you see somebody going to for a heart surgery in a heart hospital, क्या होगा? You would see कि infrastructure की भी जरूरत है. There are machines that are required. You'll see skilled laborers की भी जरूरत है. Skilled doctors you would need. You would need skilled surgeons, and you will also see skilled nurses, hospital staff, ground workers. So all these are like what? And these are like high requirements. Okay, all these will have a high cost value. But then we studied about models that actually beats this challenge. So innovative model challenges kya hota hai? They are restructuring and delivering the system. So instead of reducing on quality, these models, what they did, they focused on eliminating inefficiency, standardize, and through standardization, good operation, what we saw was increasing output. So in the class, we have discussed in detail about the entire journey of Arvinda Eye Care, about Dr. V, how he started, all of it. So right now, since this being a revision class, I will not go in very much detail. We will just try to recall what we have studied and try to remember जो हमने पढ़ा है, हमें कितना याद है, and we are ready. We are ready with our knowledge as well as for exams as well. And what happens is that, so अगर आपको कम प्राइस पे सही क्वालिटी डिलीवर करनी है, it usually comes as a challenge. और ये किनको करने की जरूरत हो पड़ जाती है, किनको करने की जरूरत पड़ जाती है, जिनके पास शायद रिसोर्सेस नहीं है उतने, है ना, limited resources. So usually in developing countries and underdeveloped countries कि आपके पास resources limited है, but आप क्या कर रहे हो कि strategic innovation through doing something in, you are making this happen, that you are having delivering high quality product at a very accessible, affordable price. Got it? So we will talk about the Arvind Eye Care model. Those who were in the class are fully aware of everything about it. We have discussed it twice, once in very detail in the class, and then we did revision as well. Here again, we will do it from a revision and exam point of view. So Arvind Eye Care is a healthcare system in India which delivers high volume, low cost eye surgery and particular at cataract surgeries and while maintaining world class standards. इसमें हमने बात करा था कि we had Dr. V. So what he did was like he was a eye doctor, and after he retired, he came back to his hometown, and there he saw that there were people who would not able to do their work properly. हमने किसानों को उन्होंने देखा, ऑटो वालों को उन्होंने देखा, जो अपना काम एक सर्टेन एज के बाद आफ्टर रीचिंग द एज ऑफ 50-45 वो अपना काम सही से नहीं कर पा रहे थे बिकॉज कैटरेक्ट वाज डेवलपिंग इन देयर आई, एंड वो वेट करते थे कि जब उनके पास सही अमाउंट ऑफ रिसोर्स, सही पैसे होंगे तो जाके मोतियाबिंद की सर्जरी करवाएंगे, पर तब तक दे वुड सफर, एंड वो उनके हर दिन एवरी डे लाइफ को इम्पैक्ट करता था. और इसमें ये भी होता था ना कि सर्जरी, इफ यू सी की कैटरैक्ट सर्जरी, तो इट कैन ऑल्सो लीड टू परमानेंट, इट कैन ऑल्सो लीड टू complete blindness. So he started with Arvind Eye Care, and this model became one of the very high efficient production system. So it functions like a very high efficient production system. यहाँ पे क्या करते हैं, surgeons are specialized in a narrow set of procedure. एक surgeon एक छोटे से काम में specialize होता है जो increase कर देता है आपकी speed को भी और accuracy को भी. And surgery is standardized. It reduces variable cost of the organization. And क्या होता है कि जो hospital का work flow है, that is similar to that of a assembly line. हमने class में discuss करा था that he also initially, अगर मैं sum up करूँ journey, so when he started providing free eye care like in a very affordable price, still people would not come because marketing was not that great. So when this he started hiring people, women 12, like young women who were looking for jobs, so like young graduates, and they would make like a call center, and he did extensive advertisement वहां पे जाके, no more than advertisement, awareness campaigns in the nearby village कि यहाँ पे क्या होगा, that if you come here you will get your free cataract surgery. But still what was happening, he faced another problem. Still the number of patients were not increases. He started with 11 beds. Still the number of patients were not increasing. What he did then was he realized that they have problem in even coming and getting a surgery, then going. So travel expense ka bhi problem aa raha tha. Then they started doing village camps. They went and they started holding medical camps in villages and then checking people, giving them awareness about the cataract surgeries as well. So इसमें क्या हो रहा था कि gradually what they did was that they had a workflow which was sustainable. So आप सोचो कि ये free में और बहुत affordable rate में provide कर रही है, and they are attracting customers, they are attracting people, because उनका जो intention था, what was Dr. V का, that was to help as many as people as possible. But it was not through only a charitable work. It became a sustainable, profitable business model, and that is why we are studying about it here. Something called cross subsidization happened. So cross subsidization is basically it a financial model. So the paying patient receives a premium service little better, and their cost of payment जो उन्होंने वहां पे पेमेंट करी है covers the cost for free or subsidized treatment of the economically weaker patient. तो ये क्या हो रही है? क्रॉस सब्सिडी स्ट्रैटेजीज को बोलते हैं. इट इंश्योर्स कि क्या होता है, फाइनेंशियल सस्टेनेबिलिटी एंड सोशल इक्विटी बोथ, दोनों की यहाँ पे बात हो रही है. ठीक है, I hope cross subsidization is clear to you. We have discussed it in the class. Then what they also have something which was strategic value. Strategic innovation lies in their process of engineering. So by maximizing on the surgeon's productivity, by minimizing their ideal time, they achieved economies of scale. And with per unit cost coming down, they can maintain a high quality outcome. What were the challenges that they were facing? Scaling the model required a disciplined, continuous, and trained staff. They also had to maintain a high volume. They have to follow a standard high volume, and any breakdown in the process or efficiency leaded to slightly impact on this. Okay? Then we come to the Narayan Health Model. Narayan Health Model के बारे में also हमने एक क्लास में बहुत ही डिटेल में डिस्कस करा है. डॉक्टर देवी शेट्टी was also once appointed as the head of Indian Medical Association. Okay, so he is also the brainchild, considered one of the brainchild for the NEET medical examinations that we are currently having. So he did something which is not only studied in India, the Narayana Health Model. He saved lives of lakhs, thousands and lakhs of people. What he did is actually affordable. It is like appreciated globally because he made cardiac surgery affordable. If you look at some of his interviews, he starts with that. So he's trained in London. He came back to India. He was practicing. He said, as a cardiac surgeon, if you will say what my day looks like, I see day in and day out. When I say a kid that they have a hole in their heart, the first question that they ask me is that, Doctor साहब पैसे कितने लगेंगे? What will be the medical expense for me to go through that treatment? Cardiac surgery is that expensive for a normal person. Not there. So he said ki day in and day out, this is the question that I ask. The mothers ask me first कि पैसे कितने लगेंगे, so that ये the most people जिनको कार्डियक सर्जन की जरूरत है उसमें से 40% ही ऐसे हो पाते हैं जो they can even go for surgery at the right time क्योंकि वो उसकी affordability के हिसाब से that they can afford it. Otherwise, lot of people keep waiting, keep bearing the pain of that disease. But that really hit Dr. Devi Shetty, and today, if you see Narayana Health Model, it is expanding, it is growing, and it is saving lives of thousands of people. They also have their own insurance scheme as well. Tejashwini, we discussed about it in class as well. So we will again do a quick recap. I hope in your exam when Arvind Eye model or Narayana Health model comes, you are able to explain it in detail like the way we have discussed in our offline classes as well. So it is a healthcare organization that provided affordable cardiac care through large-scale production and cost optimization techniques. What they played on was economies of scale. So Narayana performed large number of surgeries daily. High patient value spread was their fixed cost of infrastructure, equipments, and over per patient was reduced. So what we इसमें जो सबसे important चीज जो हमने पढ़ी थी that was the surgeons. So जो heart surgeons होते हैं they are like usually वो freelance basis पे काम करते हैं and because वो cost कम पड़ती है hospitals पे. But per surgery जो उनका cost लगता है वो डॉक्टर देवी शेट्टी did was that he made it कि per surgeon he hired permanent surgeons, and but number of surgeries ज्यादा होती थी, उससे क्या होता था कि per cost surgery का कम हो जाता था, and also he made it very specialized in process. So the senior surgeons, so there are like a kind of, not exactly a similar like, but if a operation takes around 3 hours, so and the chronic, like the most critical part is of 40 minutes where the head surgeon is needed, you had somebody, you also had junior doctors, you had intermediaries who will take care of the other processes, for example sterilization, taking care of the other processes as well. And when the main surgical part was done, the that was done by the highly skilled senior surgeon. So that division was also created. They did same way, like high patient volume spread, they same did with infrastructure as well as equipments. So process optimization was something that was very interesting and very well that was happening there. So hospital uses standardized clinical pathway and ensure that every patient follows a structured treatment process. And इसमें क्या होता था, एक स्ट्रक्चर फॉलो करते हैं, जब मैंने बताया ना कि 2 घंटे की सर्जरी है तो कितना टाइम में द पेशेंट विल बी मेड रेडी, कितने टाइम में कौन सा स्टेप होगा, कौन सा स्टेप होगा। इससे क्या होता था, जो आइडल टाइम है वो कम हो जाता था एंड इनएफिशिएंसी रिड्यूस हो जाती थी। इट आल्सो इम्प्रूव देयर क्वालिटी, इट आल्सो इनहैंस्ड देयर आउटकम। सो स्ट्रैटेजिक advantage came from treating healthcare as a system than a individual case, and by optimizing workflow, reducing wastage, and also increasing ensuring their continuous utilization of resources, Dr. Devi Shetty and Narayana Healthcare could deliver high care at a very less price. So when you're talking about cardiac surgery, you know how important it is. Okay. So, sorry. Now we go to our next topic, which are insurance schemes. So insurance schemes are basically, these are defined as financial mechanism. These are defined as financial mechanism where individual or group, they pool a resources to cover medical expenses, and this is what reducing individual financial risk. And this is strategically important because insurance increases access to healthcare by reducing their direct out of cost pocket. It allows individual to seek treatment without any immediate financial burden. Thereby ये क्या होता था कि उनका health outcome increase होता था। इसमें क्या था कि जब आप इसकी बात करते हो हेल्थ केयर की, इंश्योरेंस की बात करते हो, तो क्या होता है कि यू आर पेइंग सम फिक्स्ड प्रीमियम एवरी ईयर, एंड क्या होता है कि इन द केस ऑफ medical emergency a certain cover is provided, and it is very crucial because certain medical emergency really lead to extreme financial distress, and especially at the time when a loved one is suffering. So this is where this insurance cover comes into picture. We have discussed that in our offline classes as well. So a moral hazard kya hota? Moral hazard occurs when an individual consumes more healthcare services because they are not directly paying for them. And this can lead to what? Overuse and inefficiency. Adverse selection hota when individual with higher risk are more likely to purchase insurance, and this increases the overall cost of insurance. Challenges basically होगा that there could be issues of fraud. ऐसा होता है कि लोग प्रीमियम लेने की कोशिश करते हैं बिना इसके, there could be cost inflation, जो कंपनीज भी करती है उसको बढ़ाया जा सकता है, ओवर यूटिलाइजेशन हो सकता है, एंड स्ट्रैटेजिक रेगुलेशन से क्या होता है, मॉनिटरिंग से यू कैन एक्चुअली स्टैब्लिश इट। इससे क्या होता है कि इसको आप इंश्योर कर सकते हो सस्टेनेबिलिटी। ओके, great. So we will come to our second topic. Okay, give me a second. I hope all of you are very clear with all the models, Narayana and Arvinda models that we have discussed, and now about the health insurance as well. So what will happen that we will also finish off our revision for your first unit, okay? This is our next topic, which is telemedicine. Very interesting topic. So telemedicine is basically it is the use of digital communication technologies to provide healthcare services remotely. इसमें क्या हो रहा है कि आप हेल्थ केयर की सर्विसेज डिजिटली प्रोवाइड करने की कोशिश कर रहे हो इसमें इससे क्या हो जाएगा इसका क्या फायदा है टेलीमेडिसिन से क्या होगा ना कि इट रिड्यूसेस योर जोग्राफिकल बैरियर्स इट इनेबल्स हेल्थ केयर इन रूरल एज वेल एज रिमोट एरियाज टू बी फाउंड वहां पे भी इट कैन रीच दोज एरियाज एज वेल रिमोट प्लेसेस में भी इट कैन गो एंड इससे क्या होगा दैट इंक्रीजेस योर ओवरऑल इफेक्टिवनेस ऑफ योर मेडिकल सिस्टम जहां पे लोग नहीं जा सकते हैं जहां पे इन प्राइसेस नहीं है अगर वहां तक आप पहुंच पा रहे हो विथ योर मेडिसिन तो क्या हो रहा है योर इनडायरेक्ट योर कंप्लीट efficiency of the system increases okay and that is the strategic value it reduces geographical barriers अगर हम टेलीमेडिसिन यूज करते हैं थ्रू डिजिटल टेक्नोलॉजी अगर हम हेल्थ केयर सर्विसेज रिमोटली प्रोवाइड कर पाते हैं तो क्या होगा ये जोग्राफिकल बैरियर्स रिड्यूस कर देता है इससे क्या होगा कि हेल्थ केयर रूरल एंड रिमोट एरियाज तक भी पहुंच जाता है एंड इट ensures that low infrastructure costs and it allows doctors to consult multiple patient efficiently at a same amount of at a less amount of time okay strategic value is that it will reduce your geographical barriers it will enable rural healthcare and to remote areas and it will lower your overall cost of infrastructure it will allow doctors to consult multiple patients efficiently ये काम कैसे करता है इट वर्क्स पेशेंट कनेक्ट्स विथ हेल्थ केयर वाया वीडियो फोन मोबाइल ऐप और ऑनलाइन प्लेटफॉर्म इसमें क्या होता है कि जो आपकी डायग्नोस्टिक डेटा है दैट इज शेयर टू यू डिजिटली एंड इट इनेबल्स रिमोट कंसल्टेशन एज वेल एज फॉलो अप केयर बहुत सारी इसमें अगर आप देखोगे मेंटल हेल्थ स्पेस में भी फिजिकल हेल्थ स्पेस में भी बहुत सारे ऐसे एप्स आ रहे हैं ऑब्वियसली जो इसके लिमिटेशंस है कि बहुत सारे ऐसा होता है कि लैक ऑफ फिजिकल एग्जामिनेशन में बहुत सारे मेडिकल कंडीशन का पता नहीं चलता है एंड इट कैन नॉट बी कंप्लीटली रिप्लेस्ड बट क्या होता है कि इट कैन हैव अ सपोर्टिंग रोल it can have a supporting role and that is what it can have like a challenge so now when we go about when we go about studying its challenges we'll see that digital divide is एक चीज होती है digital divide is basically a section of population is there which is without internet connectivity which is without access to the digital devices जिनके पास फोन नहीं है इतने पैसे नहीं के फोन लैपटॉप ये चीजें नहीं है इंटरनेट की रेगुलर कनेक्टिविटी नहीं है सो इसमें क्या हो जाता है कि वो इस चीज से दे आर लाइक लेफ्ट आउट it creates a digital divide if you read about digital divide it's a very interesting topic and you'll see how this once this divide is created how it is affecting communities there could also be some trust issues क्योंकि if you feel कि डॉक्टर को physically देखा नहीं है and it can impact diagnosis accuracy that lack of physical examination can हो सकता है but it could be like कि तो ये सपोर्टिंग रोल में 100% वी आर नॉट सेइंग कि आप हेल्थ केयर को टेलीमेडिसिन के थ्रू कर सकते इट्स इन अ सपोर्टिंग रोल ओके फॉर एग्जांपल इफ समबडी इज देयर गोइंग एंड द डॉक्टर फील्स दैट उसको मेडिकल की जरूरत है तो उसको ये कहा जा सकता है कि आई थिंक योर केस इज सीरियस एंड यू शुड विजिट द नियर मेडिकल फैसिलिटी इसके अराउंड जो आपके रेगुलेटरी फ्रेमवर्क्स है, दोज आर स्टिल इवॉल्विंग, एंड सेम विथ अ लॉट ऑफ ये सेम विथ अ लॉट ऑफ अदर थिंग्स लाइक डिजिटल IT लॉज एज वेल, कि अभी तक ये फिक्स नहीं है, एंड इट इज स्टिल इवॉल्विंग. ओके, these are the challenges that we face in telemedicine. So these topics are important to you from your exam point of view. Okay. Then we have something which is known as web-based education. Web-based education refers to delivering educational content through online platforms, and it enables large scale access to learning outsource. इसमें क्या होगा? The key advantage here is scalability. Once content is created, it is delivered to millions. And इसमें क्या होता है कि आपका minimal addition cost होता है. एक बारी जो starting में आपको content creation में पैसा लगा वो, उसके बाद फिर उसके marginal cost जो होता है that is reduced to zero. How it will work? It will work through programs. They host video lectures, assignments, assessment tests, interactive content, and जो learners होते हैं ना, they can learn on their own pace. And अब ये क्या हो रहा है? It is also being supported by AI recommendations, कि AI recommend कर रहा है what should here be, किसको सीखने की जरूरत है, कैसे करना है. ठीक है. इसमें challenges क्या होगा कि completion rate है, lack of engagement हो सकता है कि वो कितना एंगेज हो पा रहे, कितना सीख पा रहे, वो थोड़ा सा कम हो जाता है. एंड देन जो इंटरेक्शन होता है वो भी कम हो जाता है. जैसे ऑफलाइन क्लासेस में अभी आई वुड हैव आस्क्ड हर्ष कि क्या होता है इसका, क्या आप बताओ, या मैं सामने से आपसे क्वेश्चंस पूछती, वी कुड हैव अ डिस्कशन. बट व्हेन वी आर हैविंग दिस वीडियो बेस्ड एजुकेशन, तो क्या हो रहा है कि इंटरेक्शन क्या होता है कि थोड़ा सा चैलेंज हो सकता है. अभी भी वी कैन इंटरेक्ट, बट क्या होता है कि स्टिल इट कैन नॉट रिप्लेस जो इन पर्सन में जाके होता है. ठीक है. सो we will move to our next, which is our next topic in our healthcare. Yeah. Okay, Nish. So it's been 1 hour. Are you guys tired? So we'll take a quick 1 minute break and we'll start in 1 minute again. Drink water or something. Okay. Feeling energetic? So now we will start with you. Okay. So हमने सबसे पहले we saw telemedicine. Telemedicine क्या है? It is the use of digital communication technology to provide healthcare services remotely. इसमें क्या होता है? जो strategic value है, it is high. It helps you reduce geographical boundaries. It enables healthcare access in rural and remote parts of the country. It lowers the infrastructure costs. It allows doctors to consult multiple patients efficiently. अगर आप देखोगे तो मेंटल हेल्थ डोमेन में बहुत सारे ऐसे एप्स है जो अभी आ रहे हैं. इफ यू कैन, यू माइट बी गेटिंग द एड्स. फॉर एग्जांपल आमला हेल्थ है, एंड देयर आर आल्सो एप्स दैट विल हेल्प यू that will help you take care of yourself through telemedicine, through digitally. And also, not those are not exactly telemedicines, but the philosophy remains the same. And also it is also used in preventive healthcare sector, where जो होता है कि आप daily basis पे अपने deficiencies, workout, अपने routine lifestyle का ध्यान रखो, so in order to prevent major diseases. Okay. वेब बेस्ड एजुकेशन में हमने क्या देखा? The one that we are having right now, web-based education, refers to delivering educational content through online platform. It is enabling large-scale access to learning resources. And this is what strategic key advantages here is scalability. Once content is created, it can be delivered to millions. We as well, we have a YouTube channel. You can see our lectures there as well. तो एक बारी बना के जो सेटअप कॉस्ट लगा है उसके प्राइसेस लगे हैं, and then now it has reduced to marginal cost reduced to near zero, and it can reach out to thousands of students for the revision before exams बाद में. And how it works, the platform hosts video lectures, assessment, as well as interactive content. Learners can access the material on their own pace. And now क्या हो रहा है कि it is also being supported and driven by AI. Challenges क्या आप face करते हो? There is a lack of engagement. Completion rate कम होता है. बहुत सारे ऐसे प्रोग्राम है ऑनलाइन जिसके लिए हमने भी साइन अप करके छोड़ दिया है ना. हम कोई कोर्स ले रहे थे, आधा करके छोड़ दिया. तो all these things. Then digital access के जो issues होते हैं are also major concerns, and it ensures quality interaction and personalized learning. This also remain a challenge कि personalized one-on-one जो learning होती है वो थोड़ी सी कम हो जाती है in your digital classes, okay, in your web-based education. Okay, coming to something which is the hot cake right now, artificial intelligence, and especially artificial intelligence we will be studying here in context of healthcare. AI is spreading everywhere. So when we talk about artificial intelligence, it refers to simulation of similar intelligence in machines, that it can analyze data, recognize patterns, and make decisions for it. सब use कर रहे हैं GPT. तो that is generative AI. So artificial intelligence in general क्या होता है? It can stimulate your human intelligence in machines, and it can analyze data. It can recognize patterns, and it can also help you make decisions. Applications में होते कि where healthcare में जब हम बात करते हैं ना, तो AI can be used for diagnostics. It can also be used for predictive analytics कि क्या होने वाला है, कैसे होगा, diagnostic इस symptoms के क्या ये है. Also in drug recovery and patient management. So it analyzes the medical images, it predicts the disease risk, and it can then automate the routine task of the doctors and medical professionals. Isme what it is doing? It is used in diagnostics, predictive analytics, and drug discovery. जब आप किसी डॉक्टर के पास जाते हो वो आपको बोलता है कि मुंह खोल के दिखाओ, आंखें ऐसे करके दिखाओ, हाथ दिखाओ, ये क्या होता है? दैट इज द प्रोसेस ऑफ डायग्नोसिस. वो देखने की कोशिश कर रहा है कि टंग पीला है कि नहीं, हाइड्रेशन कितना है. सो दिस इज लाइक उसके बेसिस पे वो डायग्नोस करते हैं कि कौन सी प्रॉब्लम, कौन सा इशू है, कौन सी बीमारी है. सो उसमें प्रिडिक्टिव एनालिटिक्स में, ड्रग डिस्कवरी में कि कौन सी सिचुएशन के लिए कौन सा ड्रग होता है, क्या होता है, पेशेंट मैनेजमेंट के लिए. एंड देन it can analyze medical images, CT स्कैन के वो करके वो दे सकते हैं. what it means, टेस्ट रिजल्ट्स होते हैं आजकल. मैंने देखा कि लोग अपने ब्लड टेस्ट रिजल्ट्स AI पे ऐसे GPT पे डाल दिया, उसके बाद फिर वहां से वो सजेशंस ले रहे हैं. देयर आर अदर AI टूल्स एज वेल जो बहुत इसके लिए इफेक्टिव है. So the thing with AI is that still it is in its growing stage. So they even mention कि GPT can make mistakes, so you cross verify the information. So right now also when we talk about it, we talk about it in a supportive role. And ये also क्या कर सकता है, आपके tasks and routines को automate कर सकता है. Okay. Then we talk about something which is strategic value. AI improves the accuracy as well as क्या करता है, ये efficiency को भी बढ़ा देता है. Accuracy बढ़ा देता है, efficiency बढ़ा देता है. It reduces your dependency on human labor for repetitive task. जो वही काम है जो वही बार बार आ रहे हैं. एंड इट क्या करता है, इट enables scalability of your healthcare delivery. And this is also we are seeing it as a right now we're seeing it mostly in supporting role only. We are not seeing it as, we're not talking कि ये replacement role में है as of now. Okay. So what are the concerns that we have with AI, artificial intelligence in healthcare? कंसर्न से पहले एक मेरे को आप मेजर एडवांटेज बता सकते हो? एक बहुत ही बड़ा मेजर एडवांटेज ये भी होगा, रिडक्शन ऑन द बर्डन, जो रिडक्शन ऑफ वर्क, जो हमारी मेडिकल वर्क फोर्स है उन पे जो हाई प्रेशर सिचुएशन रहता है बिकॉज ऑफ द नंबर ऑफ पेशेंट्स दैट वी हैव, दैट कैन आल्सो बी टेकन केयर ऑफ. देयर इज अ रिडक्शन इन दैट कैन रिड्यूस विद द हेल्प ऑफ एआई, अगर रूटीन और रिपीटेटिव टास्क वो कर रहा है तो. सेकंड इज, सेकंड, it could be more cost effective as well, you know, पैसे भी आपके as compared to ये कम लग सकते हैं, so it could also be cost effective. So I'll put my laptop, I've put it to charging. I'll check, 1 minute, it's charging. Okay, fine. So इशू क्या है जब आपका ये आपकी आपकी वर्कफोर्स पे ये आपका बर्डन भी कम हो रहा है जो मेडिकल प्रोफेशनल्स पे है, अगर ये कॉस्ट भी रिड्यूस कर रहा है. सो व्हाट आर इशू? देयर आर अ लॉट ऑफ एथिकल कंसर्न्स व्हेन इट comes to talking about AI, and there is also a concern about your data privacy, because क्या होता है कि data privacy is basically protecting your patient's information from unauthorized access. जिसको जरूरत नहीं है to know about my healthcare history, उसको उसका access नहीं हो, और person I or when to the it is shared only to the extent I would like to, because healthcare data is very sensitive. Breach of that data has serious consequences. So strong encryption, strong storage, regulatory compliances are very essential in this case. Okay. हम बात कर रहे थे एथिकल चैलेंजेस की, वो होता है AI raises concern of bias.